Hi, everybody. I'm Dr. Patti Ashley. I'm here in Boulder, Colorado, and I am interviewing an incredible physician and author this morning for the Fear to Love to Grace Summit. He's a professor of pediatrics and anesthesiology, preoperative and pain medicine at Stanford University School of Medicine. He's been practicing these specialties since he completed fellowships in pediatric anesthesia and critical care medicine at Children's Hospital of Philadelphia in 1988. He's been at Stanford since 1995, lucky man, and was promoted to professor in 2003. He's done some work that's been funded by NIH and published over 100 articles, and he's a health enthusiast, a meditator, and he utilizes non-duality and mindfulness-based approaches. And he also teaches that to his residents and his students. And he has a practice that he calls present practice that he teaches. And I am so excited to talk today to Dr. Gregory Hammer. Hi, Greg.
Hi, Patty. So nice to be with you.
Oh, it's great to have you here. I'm excited. I was introduced to you by Aurora Winter, one of my other authors that I'm interviewing, and she tells me your book that's coming out is pretty amazing. It's called Gain Without Pain, correct?
Yes, Gain Without Pain, and the subtitle for this one is The Happiness Handbook for Healthcare Professionals.
So important, isn't it? I mean, the healthcare industry today is probably at times not too happy. So you're probably doing a lot of service to your field. So tell us more about the book. Tell us all about it.
Sure. Well, I guess convergence of two things. The first is my own spiritual practice, and the other one is what's happening at Stanford in terms of focus on wellness. So with respect to the latter, I would say that there's a growing problem of burnout in medicine. And I don't know to what extent that's been studied in areas, for example, in nursing or respiratory therapy, other technical aspects of work in hospitals and clinics, but there has been a lot of data generated regarding physician burnout. Physician burnout is defined in ways that I think that are largely intuitive. It's a depersonalization. You talk about shame. It's a feeling of shame about things that have happened in the past in our practice, because if you practice long enough, you're going to have some bad outcomes. We tend to blame ourselves. We have a negativity bias. We can talk more about that if you'd like, but we tend to remember all the negative things. And in medicine, those negative things are important and may in fact involve life and death. So burnout is defined as impatience, self-blame, depersonalization, all of the things that we all recognize as burnout. And that's been studied through quality of life surveys, which really, that survey science for physicians was really largely started by a guy named Tate Shanafelt, who headed the wellness program at the Mayo Clinic in Minnesota. We had our own wellness program, I think, on the cutting edge among universities and hospitals starting in around 2013. We subsequently recruited Tate, so now I think we have the whole deal. And we have a program called WellMD that I've been a part of for the last several years. Mm-hmm. So burnout in medicine has drivers and costs that have been fairly well circumscribed. Drivers include things like, having to see more patients per hour, decreasing patient satisfaction, which is important as we all are exposed to a lot of metrics, which have increased. We hire expensive consultants to come in and help gauge the efficiency of our practice. We have administrators within the hospital who are very focused on that. Much of this feels like we physicians are being blamed when patients are unhappy and so on, though most of the circumstances leading to their dissatisfaction are not related to us. They're related to longer waiting times in the waiting room, less time with we physicians. Again, those are things that we cannot control. So although I think that hospitals and medical schools and clinics are recognizing this problem increasingly, more than half of we physicians have symptoms and signs of burnout. So meanwhile, I have my own meditation and spiritual practice, and I've been teaching my trainees and some other faculty members a method of meditation that I thought up, let's say, based on 4 fundamental principles. And I was being asked increasingly to speak about this in the context of physician burnout at other hospitals and universities and national meetings. That sort of led to simultaneity, as you and I were discussing previously. I had a sabbatical coming up. I was trying to figure out what to do. I have a busy laboratory here at Stanford. I couldn't really go anywhere. So I decided, based on the very favorable feedback I'd had on my lectures and teaching a meditation based on the GAIN principle, to write a book. So again, it's kind of the culmination of my own spiritual and presence practice. And also, I think, a need in the medical community and greater healthcare community for this kind of book, which relates primarily to resilience. How can we be more resilient? How can we withstand with equanimity all of this increasing pressure in the field?
That is so important, Greg. I have a really good friend here who's a physician, and she's moved practices a couple times over the past few years because they've been bought out, and then this whole how many patients can you see, and she's so personable, and I've also had somebody tell me once about another physician who her reviews were bad because she took too much time with patients. And so I have heard stories over and over, and I have friends who work in the hospital here, and that piece of work that you're talking about is so important. And tell us about the acronym GAIN a little bit more, because I think that
Sure.
that's important.
As I had more experience teaching students, medical students, and medical trainees, and some of our faculty and faculty elsewhere about meditation and resilience, I kept hearing, well, we don't have time to do the things that make us feel more resilient, such as go to a yoga class or go out for a bike ride or socialize with a group of friends because we're too busy. Mm-hmm. So I thought, well, the fundamentals of my own personal meditation can be really practiced in a very short period of time. And we learn by repetition. So I pretty much devised this methodology to adhere to the needs of others as I was hearing them, that it had to be something brief, and I thought that it could be. So I kind of condensed the foremost, I think, important principles of happiness and resilience into this acronym GAIN and into my own personal meditation and that which I teach. And the acronym of GAIN represents gratitude, and that's the G. As I say in my book, I think that you can be blind and happy, you can be deaf and happy, you can be disabled and happy, but you can't be ungrateful and happy. So I think gratitude, and this is not something I made up, of course, I think it's central to many belief systems and self-help systems, if you will, that gratitude is extremely important. We all have a lot to be grateful for. Because of our negativity bias, we tend to focus on the things we don't have, or the things, our circumstances that are not favorable, instead of focusing our time on what we do have and how joyous what we have is. So gratitude is central. The second letter in the acronym GAIN is acceptance. And again, I think this is not something that I made up, but for example, the serenity prayer, the principle being that we need to discern between the things we can change and those things that we can't change. The things that we think we can change, we have to really think hard about whether we have the time and resources and energy and expertise to change those things. And if we don't, then we move that into the category of things we cannot change. And then those things that we cannot change, we have to accept. So for example, it's very common in my world for me to walk down the hall and pass a couple of physicians or nurses who are complaining about the way things are, because that's just part of the environment these days. And I think that itself leads to burnout or facilitates it.
Mhm.
We need to figure out what we can't change. So certain things about healthcare delivery that are not going to change anytime soon, we need to accept those. You and I have both experienced loss in our lives. We need to accept those because there's nothing we can do about it. Just as there's nothing in the world at large about many things that seem horrific to us that we can change. Conflict elsewhere, things that happen over the centuries, slavery, ravaging of our ecology, the place we live getting more crowded and less pleasant. So we need to accept those things and not resist them. There's a little formula in my book, which is pain equals, I'm sorry, I misquoted, suffering equals pain times resistance. So if you have something painful and you resist it rather than accept it, it's going to increase the suffering. The pain is there, but the pain can be embraced rather than resisted. And the more we kind of push back against things that are painful to us that we can't change, the more we suffer. So that's gratitude and acceptance. The I stands for intention. And this is a fundamental property of mindfulness practice, for example, that we do things on purpose right here, right now. So we can guide the way our lives unfold to a large extent if we focus on it with intention. And we can rewire our brains, which have acquired this negativity bias and this obsession with the past and the future. We know that happiness is in the present moment, yet our minds are often in the past where we feel regret and shame, and in the future where we feel fear and anxiety. We can rewire our brains. I can tell you a little bit about an interesting study related to that if we have time, but that's intention. We have to focus on it. We have to be mindful. We have to do things with intention. The N stands for non-judgment. And this really speaks to the fact that much of the way the world is, we did not create, we cannot fix, and we don't have to judge things as good or bad. They simply are what they are. Whereas our minds are constantly putting things in little boxes of good or bad, and it's really exhausting.
Yeah.
And it makes us less happy. Right. So non-judgment is really, I think, the fourth pillar of being present and being happy. So that's a gratitude, acceptance, intention, and non-judgment. And the meditation that I teach is really a contemplative meditation that involves these four principles. And that can be done in as little as 3 minutes.
Wow, that's amazing, because all those parts are so important. As you were speaking, I was thinking of little snippets for each one, that I use in my practice and my work. And the brain research, yes, I'd love to know a little bit about that. And I also saw that Dan Siegel endorsed your book. So I'm a big fan of his work and what he's discovered about the brain. And my book that I'm writing now that's almost finished is on shame and the art and architecture of reconstructing the authentic self, and really all about rewiring our brain and our nervous system. And a lot of it is really related to what you're talking about when you talk about the four things in your acronym of GAIN. It's beautiful. It's perfect. So do you have a minute to tell us a little bit about the research you mentioned?
Well, just as far as the intention, sort of getting a 30,000 foot view, we're born into a world that for us as newborns, I believe, has really no time or space. We're newborns. We don't really know what is our boundary, if you will, which is really something we make up as we go along, but we don't have it when we're born. We don't know where our hand ends and where our mother's breast begins, for example. We're not worried about what happened 15 minutes ago when we were in our mother's uterus and what's going to happen tomorrow. And then as we begin to develop, and being a pediatrician and having a critical care and anesthesia practice, I see newborns and treat them and their families and infants, toddlers, school-age children, and adolescents. And like anybody who has kids, I see how things develop and the things that children and adolescents think about. And as we develop into childhood and adolescence, we begin to be more obsessed with the past and the future. And this is adaptive up to a certain point because, for example, we need to learn from our mistakes. So we don't want to forget our mistakes. Hopefully we could learn from our victories too that happened in the past. We need to plan for the future, especially as we get older. When we're teenagers and probably even before that, we have to prepare for getting into a good college. So there's a certain amount of future and past orientation that's adaptive. But when we get stuck in these, that's maladaptive. And our brains get wired to be that way as we grow up from newborns to infants to school-age children to adolescents. Mm-hmm. So the research that I mentioned was referable to the I in gain, which is intention. And we can do things on purpose to rewire our brain so that we have less of this negativity bias and less of this maladaptive obsession with the past and the future. And one example of research that has been done in that respect is called 3 Good Things. I don't know if you've heard of that. Mm-mm. It's a program that was initiated at Duke. Essentially, anybody can go online and sign up and be a participant in the study. I think it's still going on. But the idea was simply that you take a quality of life survey before you participate in the study. And then when you are initiated into the study, you pledge that each night before you go to sleep, you'll think about 3 good things that happened during the day.
Yeah.
And this really doesn't have to take any time, of course. You can do it while you're turning down your bed linens or, just going through the activities you do before you go to bed. Just sort of take stock of your day and think of 3 good things that happened. And what they found is if you do this every evening, it actually helps you sleep and it makes your quality of life better. It makes you happier. And that's documented by periodic quality of life surveys that are taken. So again, that's just a very poignant example of how with very little work and time commitment, we can do a practice with intention or on purpose that will begin to rewire our brains toward being more happy. So this is a well-known phenomenon that we're in charge of the way we think. And if we just practice persistently and consistently, we can change some of the maladaptive thought processes that are running through our brains all the time.
Yeah, I love that. And I do think I've heard of that study, but I'm going to check it out even further. And I think that goes back to the gratitude piece too, even though you said it was under intention. I think, what I've learned about gratitude is it actually does rewire the brain. It gives us this feeling of something good and appreciation. And that's what our bodies need. And the negativity biases, over a period of time of all the things, Eeyore, oh my bother, this happened, that happened, and then we forget that there's also all these other things. So to have that practice of 3 good things at night is a great practice. I think we should all do it. One of the chapters in my book, I talk about my partner, Lawrence Freedom. He, every night before we go to sleep, he'd go over, especially on the weekends when we spend our days together, and he'd say, let's see, what did we do this morning? We got up, we had coffee, and then we went for a walk. And so some nights when we'd go to bed and I'd be waiting and he hadn't started, I'd say, do our day. And it was just the sweetest part, one of the sweetest things. It was just such a nice way to go to sleep. And now that he's gone, I try and do that myself sometimes, but he was really good at remembering. I forgot by the time, it's 10 o'clock at night, I forgot what I did at 7 in the morning. And he had a bad memory, but he would remember. So anyway, that's a great practice. And speaking of grief and loss and relationship in my book, the part of the reason I wanted to do the summit, Fear to Love to Grace, was a legacy to my partner, Lawrence Freedom, who was writing a book titled that. And he started writing about things related to grief and loss and his experience of grace. And so I'm asking everybody that I'm interviewing to just tell us a little bit about how they see grace in their lives and what it means to them. Because grace is one of those words that, bounces all over in terms of semantics and what it means to people. But can you share with us in your work? Because what you're doing to me is full of grace. it's this gracefulness of bringing this presence into into the medical arena, which is yay. So anyway, I don't know, that might not be your definition, but I'm feeling a sense of grace in our conversation. So
Well, first of all, just in response to what we've discussed so far and what you said in the beginning, I think that the principles of gratitude, acceptance, intention, and non-judgment are all interrelated. And they're all very fundamental. They all fit together. They all reinforce one another, if you will. I might define grace as presence, because if you think about the happy, graceful times that we've all had, those times are when we are fully present. Whether it's connecting with the nature around us as we take a walk through the forest or sit on the beach watching the waves.
mm-hmm.
When we are right here, right now, we're perfectly content and happy. If you sort of close your eyes and take away your memory, so you're here right now, you don't have the visual cues of perhaps association with past or present as well, you're content. And that's to me what grace is, because when we're present and content, we live our lives, or we are experiencing in that moment the important principles of happiness, generosity, kindness, and all the elements that you might say comprise what most of us think of when we think of the word grace. I would say that grace is being grateful, accepting, intentional, non-judgmental.
Yeah, I would agree. And I think your book title is perfect and speaks so well to those aspects of our life that are so important. And I also want to, I know you as a working in pediatrics, and you've probably in your personal and professional life experienced grief, and finding those moments of grace in grief and those moments of gratitude, acceptance, intention, and non-judgment in grief. Would you want to share with us some of your experiences around grief in relation to the parts in your acronym GAIN and GRACE, for that matter, because it is definitely very similar to me.
Yes. With respect to my medical practice, yes. I still remember the handful of times when a child died in my presence, essentially.
Yeah.
And those cases that, had I done something differently, the child might not have died. So I think in some ways there's commonality with parenting. Sometimes we face a fork in the road and we don't know which way to go. There's no right answer. And although Yogi Berra said, when you come to a fork in the road, take it, that's not terribly helpful in the real world. And I've had patients whereby if I recognized what was going on with them just a few minutes earlier, I could have intervened before they had a cardiac arrest, for example, and had a bad outcome. I write in my book about a patient who had fluid accumulating around her heart, inside the sac around the heart, which is called the pericardium. And several of us were evaluating her, doing echocardiograms, listening to her chest, et cetera, and missed this diagnosis, even though we were considering the diagnosis. And she had what's called a pericardial tamponade, where the fluid built up to the point that the heart could not fill and contract and inject blood to the body, and she had a cardiac arrest, and she ended up with a bad outcome. Had we known what was going on just a minute or two, literally, before she had the cardiac arrest, I could have put a needle in the pericardial sac and drained the fluid. If you practice medicine in a high acuity setting, as I do in intensive care and in cardiac anesthesia, these things are going to happen. And they cause considerable self-blame, self-doubt, and grief, no question about it. And the only way really to transcend that grief and shame and remorse is to accept and not judge ourselves. So again, being grateful for all the times we did help our patients and their families, being grateful for all the good outcomes that have resulted from our care, accepting that in every high acuity practice, there are going to be deaths that are preventable. We're human. We, just like I'm sure all of us with children, made a decision in rearing our children at a particular time, like, should I get them a cell phone? Should I let them have access to the computer in the room, et cetera? I mean, there's a lot of decisions that we make as parents, and sometimes looking back, we wish we had done things differently. But the grief associated with the loss of a patient and the understanding that maybe it didn't have to be that way really requires that we deal with this with grace. And I would again go back to the 4 principles that we've been discussing, and that is gratitude for our ability to be in the practice that we are, to help these families, to have helped so many patients and their families, accepting the fact that patients are often critically ill and some of them are not going to have a good outcome. Being intentional or purposeful about bringing ourselves back to the present when we find that we're reliving these events in a way that's maladaptive. Not resisting exactly, but embracing our feelings and the tragic nature of some of these events. And then again, non-judgment, not judging our peers, not judging ourselves, which is the most difficult thing.
Yeah, that's got to be tough to go through, and really important and helpful information for people in the field.
I would also say, as you and I briefly discussed, Patty, that I also lost someone I loved very much, who was my son. And I know what you've been through, and we've had a conversation about others we know who have lost people very close to them. You know, I went into a bit of a tailspin after my son died. And the way that I kind of pulled myself out of that tailspin really was going back to these principles. And I actually found myself feeling grateful that I had 29 years with him, and thinking of all the wonderful times we had and how appreciative I am for those. Accepting the fact that he's no longer here. And again, that's something I sit with every morning when I do my gain-based contemplative meditation. Mm-hmm. Having intention to think of all the good things. Again, there's overlap here. And not judging myself for not having done something differently that might have precluded his death. So it's not that I don't grieve every day, but increasingly I do so in a way that incorporates what I would call grace.
How long ago was that?
It was almost 3 years ago.
Oh, okay. So similar time frame to my last one loss. It's so hard to lose a child. I mean, especially, you know, you work in pediatrics, it's hard. Grief is just hard across the board. But I think when you know, that must have been really difficult to move through that kind of a loss. You know, we all think we're going to outlive our children. So yeah, I hear that. Your method is helpful. And I also heard earlier about not resisting. So I'm also, what I'm making up from your story is that you've been in the depths of the pain of the grief, because obviously we can't go around it. We have to go through it, right? What we resist persists and often grows stronger, which is a quote by Carl Jung that I'm trying to find, and so I can reference it, but I can't find where he said it. But it relates very much to what you were saying earlier. So I think that was with the intention part, right? Is to be with what comes up. Am I correct in putting that piece in there around, you know, there's no way to go around the pain of losing anyone, and, you know, losing our son.
We can talk about dealing with grief gracefully through any of those four elements, if you will, the gratitude, acceptance, intention, non-judgment.
Right.
Excuse me. I may have brought that up in the context of acceptance.
Okay.
Because, again, we have to discern between things that we can change and things we can't change. And certainly when somebody dies with whom we're close, that's not a circumstance that can be undone or changed.
Right.
So we need to kind of open our hearts to that, open our hearts to the pain. So as I sit in the morning and do my gain meditation, the idea is first to get in touch with the breath, which I think is fundamental to being present in many practices, of course. Mm-hmm. So there's ways that I propose that can help you do that. You get into your breath and sit more and more peacefully with your breath, visualizing the entry of air through the nose and out the nose or mouth, filling the body, filling the head, etc. And then to go through in a contemplative manner the elements of gain. So then I will let gratitude just sort of appear. And again, it's there. Mm-hmm. The elements of gain and grace are within us all of the time. Mm-hmm. We simply have to relax into it and open ourselves up to that presence. So in the meditation, we go through the appreciation of all of the bounty in our lives. And no matter what we want to dwell on at times that's negative, it could always be worse. Mm-hmm. You know, I have a pain in my left knee. Well, at least my right knee is okay. So we can be grateful about that. Mm-hmm. And then again, you know, moving through acceptance in the face of grief, recognizing that this is something that we can't change. I actually teach and practice a visualization of opening the chest and opening the heart and letting that pain in, getting closer and closer to it, embracing it until it's actually not separated from how we conceive of us. Right. And we merge with that pain, we consume it, we join with it. And that's really how to accept it. Right. And I think when dealing with these awful, inevitable, grief-filled experiences we live in life, it's essential that we learn to open our hearts to it and accept the pain and embrace it.
And I love that, because I think that is, you know, we want to close that off because it's so painful. And our culture doesn't really teach us how to do what you just said. So I'm so glad you wrote the book and, you know, give people that opportunity, because you're not saying just accept that my son died and I'm good. You're saying I'm accepting this happened and I'm opening my heart to all the aspects of that which involve deep sorrow. And Kahlil Gibran's poem, Joy and Sorrow, you know, where he says they're the same. And, you know, we talk about happiness and the negativity bias, and we talk about, you know, how to do that. And to me, my work has really been, you know, how do we really embrace the dark night of the soul, basically, and one of the way to language that. So, because sometimes we want to talk over it, you know, and say, you know, just accept it, you know, or, you know, at least, and people say, well, at least you had 29 years with him, or, you know, it could have been worse, you know, those sorts of sympathy, kind of get over it tapes that we do because we want to help people. We don't really tell people to do what you just said, which is sit with the heart and open the heart and be with it. There again, in my experience is we can't go around grief. We have to go through it, but we don't have to get stuck in it either, which I think, and that's the harder part for us humans to get, you know, right?
Yes, I mean, we many of us have heard of the term spiritual bypass.
Yes.
Which in the sort of new age of Advaita and spirituality might mean when we're met with something terrible, like the death of somebody we love, to just jump over the pain and just go to a place where it's okay. The universe is the universe and it's okay. I don't think that that's wise. And again, this term spiritual bypass is descriptive because we can't just bypass the grief. As you said, we have to go through it. To me, that means we have to open our hearts and really sit with it in a very sincere, open manner until we feel it becoming closer and closer and merging with us. And I think the visualization with the eyes closed of the chest physically opening and the heart opening and letting these waves or particles, depending on your quantum view, come into the heart and sit with it until we feel, and we really, in our true experience, feel that we're accepting it. That process cannot be shortcut, if you will.
Yeah, yeah. Well said. And spiritual bypassing was the word in the back of my mind as I was speaking. So thanks for bringing that to the consciousness of our conversation, because I see a lot of that, you know, because it's hard. Who wants to go into the pain of grief? No one, really. Like I said, when my partner died, the same way my father died, I you know, it's stunning. And I went, okay, you know, here's what I got. And I'm going to be able to now as an adult be aware of that more than I was as a kiddo, which is why I wrote my book. So it was delightful to hear what you're doing in the field of medicine today, which is so needed. I can't wait. So when will the book be out?
The book should be out as an ebook within the next 6 to 8 weeks.
Okay, great.
And then a hardback, or rather a soft cover physical copy of the book will come out soon thereafter.
Super. So right around the time of the launch, we're launching on February 4th. Well, actually 6 weeks. What am I thinking? Time. That's 2 weeks from now. So we'll have information on my website so people can find out how to get your book and get in touch with you and find out more about what you're doing. Is there anything else you want to share with us today? Thank you so much for your time. I really enjoyed our conversation, but I want to be sure, I want to ask, was there anything else that you think?
Well, you and I could have a lot more conversation about these essential topics. But for now, all I can say is that it's been really great connecting with you, Patti, and congratulations on the book and all of your good work.
Thank you, Greg. It was wonderful talking to you, and good luck with your book too. It's so important. I'm going to be excited when it comes out to share.
Thank you, Patti.
All right. Take care.